A few months ago, I surveyed 1,000 parents, asking what their biggest parenting struggle was. The overwhelming majority had the same answer: outbursts and behaviors. So how do we prevent our child from turning green and going into Hulk mode? My go-to is a skill from DBT called the TIPP skill. And this is a crisis survival distress tolerance skill. You use this skill when your child is emotionally overwhelmed and their brain is not capable of processing information correctly. The goal is to reduce the intensity of your child's emotions very quickly. So when we look at the TIPP skills, each of the letter of the word TIPP, so TIPP, stands for an action we have our child take. And the letter T stands for temperature. And this is my personal favorite skill to use with kids. Ultimately, ice water is known for being able to rapidly decrease your heart rate. It activates the dive reflex, which is when humans and other mammals immerse themselves in very cold water without oxygen, and it basically causes the heart to slow down to below resting heart rate. And there are many ways to do this technique, and the traditional way that is taught in DBT is to fill a large bowl with cold ice water. Instruct your child to hold their breath, and then have them put their head in the bowl of water. You want them to submerge their head down to the level of their temples and hold it down for around 10 to 30 seconds in the water. You then want them to repeat this process for another 2 to 3 times. Other things to try include holding freezer packs or bags of frozen vegetables on the back of your child's neck or under their eyes on their cheekbones. I have a teenager that I see in clinic who will splash cold water on his face while at school during times where he feels panicky. Cold showers or the infamous ice bucket challenge are other ways that people practice this skill. The next skill is the letter I, which stands for intense exercise. When we have intense emotions, it prepares the body for action. So for example, anger prepares us to attack, and fear prepares us to run. So when we are highly aroused, this skill allows us to act to regulate the body instead of acting impulsively on our emotional urges. The goal is to calm the body down when it's revved up by emotion. The way we do this is by having your child engage in high intensity exercise for around 10 to 20 minutes. And this works to decrease their negative mood and rapidly increase their positive mood. And this can be accomplished by many activities, so jumping rope, running, dancing, going up and down flights of stairs, or doing jumping jacks or push-ups. The key is, with whatever activity you choose to have them do, you want them to do it intensely so that they can expend their stored up physical energy. The first letter P stands for paced breathing. And the nice thing about this skill is that it can be done anywhere because we always have our breath with us. When we do this, we want to slow the breath way down and breathe deeply from the stomach. For younger kids, having them lie down and putting a pillow or stuffed animal on their belly can help because this allows them to physically see the pillow or stuffed animal move up and down. They could really visualize those big, deep belly breaths. And you want to instruct them to breathe in for 4 seconds and out for 6 seconds. And regardless what count you use, you want to make sure that the exhale is longer than the inhale because our heart rates increase slightly with inhalation and decrease slightly during exhalation. And you want to have them do this for around 1 minute. The second letter P stands for progressive muscle relaxation. With this exercise, we try to relax our bodies and focus on specific groups of muscles. And it can be completed either by lying or sitting down, and the goal is to go from head to toe, tensing and then relaxing each muscle group. So I typically start with the eyes and forehead, instructing the child to shut their eyes tightly and squeeze their brows together. I have them hold this for 10 seconds and then release for 10 seconds. And the goal is to notice the difference between the tension and then the relaxation. You then continue this process and repeat each step with all the other muscle groups. I typically start with the forehead and eyes, and then I progress down the body to the nose, the cheeks, the mouth, the neck and shoulders, the back and shoulder blades, arms, hands, abdomen, butt, thigh and calves, ankle and foot. After you complete the last muscle group, end by squeezing as many muscle groups together as possible for 10 seconds and then release. You can repeat this 2 to 3 times, and then lastly, you just want to scan your muscle groups and try to notice any remaining tension. Then let that tension go. The final thing that I talk to families about when teaching these skills is to practice ahead of time. We don't want to try to teach our child a new skill when they're going into or are already in Hulk mode. they aren't thinking clearly and they can't take in new information at that time. Similar to exercising and building up certain muscles of the body, we want to treat the brain like a muscle. We want to build it up and strengthen it. So try to teach these skills to your child when they are calm and receptive to learning new information.